Hey, Dr. Anica here. I am so thrilled that you guys are joining us for another one of our interview specials. And today I've got with me my friend, Dr. Apyrl Alexander, and she is a clinical assistant professor and a psychologist who does a lot of research and activism in many, many areas. And today she's going to talk to us about some of her concerns and how we really can survive in this pandemic. So thank you so much, Dr. Alexander, for being here with us today.
Yeah, thank you for having me.
Of course, my pleasure. So we're going to go right into it. Every day we learn more and more about the stark differences in the way that COVID is impacting different groups of people, whether it's the elderly, people with pre-existing conditions, and now we're learning more about the impact it's having on people of color. For you, given your activism and your research, is there any particular group that you're most concerned about at this time?
Yeah, I think I'm most concerned about individuals from marginalized identities who've been historically marginalized in other types of systems prior to when COVID started. So some of the concerns that are cropping up for me are people who've lost their jobs during COVID, both adults and juveniles who are incarcerated at this time and susceptible to COVID coming into those systems, pregnant women, people of color who already have been impacted by disparities within the medical system. And so those disparities are just being carried on and exacerbated. So we have this kind of broad range of individuals who have already faced marginalization, and that marginalization is going to be exacerbated by the effects of COVID.
Got you. Absolutely. And it makes a lot of sense, right? That if the conditions were already in place, having a tragedy on top of it will only exacerbate that tragedy and those conditions even more, right? In recent days, we've seen a lot of data around COVID, particularly in places like Louisiana, where they have a Black population of 32%, but 70% of those who died were Black. And those disparities are just startling. For many, I've come across several different theories for why that is, but what are your thoughts on why that disparity exists?
Yeah, so we have kind of two factors. First, social determinants of health. So all of the kind of factors that make sure that we have good physical and mental health. So do we have access to good, clean air and water? Do we have access to education and vocational services, adequate housing and food resources? All of those things help determine whether or not we have good or bad health. And so what we've looked at over time is that Black populations are impacted by these social determinants of health. There's communities that have food deserts, so you don't have access to areas where you have good groceries and fruits and vegetables, and so that impacts health in those communities. Here in Denver, we're facing housing crisis. That we have so many people moving into the Denver metro area, and that housing rates are going up, and so it's unaffordable for most people to live here. So all of those factors do affect Black populations the most. Then we need to think about where those social determinants of health came from. They came from systemic and institutionalized racism. So when we're compounding all of those things together, we know that these communities are going to be impacted the most. We know that even within medical systems, that there's a lot of bias there. There have been studies that have examined that doctors are less likely to give pain medication to individuals of color when they're expressing pain problems, less likely to believe them. In the last 2 years, we faced this Black maternal mortality crisis in the United States, where Black women are dying at childbirth or right after childbirth. So these things are all being exacerbated right now, and that's why we're seeing the numbers that you mentioned earlier, that St. Louis, 100% of the fatalities due to COVID were for Black people.
Wow.
And so, the questions that I have for myself and that other legislators and activists are examining right now is, can we get those numbers? Because those numbers can help us to examine these social determinants of health. It could help us examine bias within our medical system. So who's getting tested for COVID, who's getting their results back, who's being referred for testing, and then who ultimately is getting adequate treatment for COVID.
I love that. And I love it because I think it goes so much deeper into the numbers, right? It's not just stopping with saying, okay, well, more Black people are dying from COVID at the end. We're asking why. And I think the questions that you're raising and the social determinants that you're pointing to really encourage us to dig deeper. And so along those lines, if there's any good thing, and I use that word loosely, if there's any good thing that came out of COVID, I feel as though it's underscored and highlighted some of the disparities and inequities socially that we've we've had for a long time in this country. And I think it perhaps provides us a really good opportunity to create or implement or shore up some sound policies that perhaps can improve the quality of life for all people, particularly when this is all over. So for you, are there any social policies that you'd like to see implemented, altered, eliminated even, that you believe would help to really improve the quality of life for all people?
Yeah, once this is all resolved, I hope we take this as a learning lesson, and that all the things that activists and social justice individuals have been advocating for decades have been exacerbated by this crisis. And like you just said, it's affecting everyone. So when we're talking about access to education and who has computers in their homes for their kids, or a ton of our kids, their only meals are breakfast and lunch, and those are in schools. So now that we have these stay-at-home orders, they don't have access to adequate food during the day. So what I'm hoping is that this is going to push for an immediate shift in those social welfare policies. Again, educational access, health access. Again, politicians have been talking about Medicare for all for the longest, and it's been denied. Well, now people don't have access to care, and that the unemployment rate is rising right now with COVID because people are out of work, because of these stay-at-home orders or these shelter-in-place orders. And so many people are impacted and didn't realize that these policies were to create safety nets for us, for everyone. So I hope to see a lot of those changes once this again is resolved, in terms of let's start critically thinking about our housing situation, our food situation, social welfare policies, and educational and medical access.
Absolutely. And I really think that it's so important, right? Because as you've been saying, a lot of these conversation points, a lot of these policy initiatives are things that have long been touted by many activists for many years. But if anything, it's just shown how critical those changes and those policies that are presented have become, right? For the survival and the really the thriving of our country. And I also think what you highlighted there is just the relevance of we are indeed our neighbor's keeper. That for so long, social policies and things like you mentioned, whether it's healthcare improvements or educational funding, that it's often been touted as someone taking from you, or this sort of welfare state that's been presented. But we're seeing now that the lack that your brother has significantly impacts your quality of life, right? It doesn't matter if you care about the homeless person on the street or not. If he has COVID, you still can't go to work. So you need to be interested in what resources are available to him. So I just love what you said there, and really coming back to what those policies are that have long been touted, but perhaps it's the time for us to start taking action on them. For you, is there a book, is there a website, maybe even a resource that you'd recommend people who, even now in their homes, want to become socially engaged and socially active? What would you recommend that they do?
Yeah, a lot of people are coming together immediately in this time, and again, trying to think of solutions. So get out there and start following your state legislators. Our state legislators had a town hall yesterday talking about things that they're addressing right now. So they were having drive-through areas where kids could pick up food during the day and their caregivers could pick up food during the day. So follow what's going on in your local communities to see where you can have the most impact. Other activists who've been, again, talking about these issues for the longest time, get connected with them. So the Black Lives Matter movement, standing up for racial justice. There's a Black_COVID link right now on Twitter that's talking about how COVID is impacting the Black communities. Finding ways to kind of get involved and educate yourself on all these issues. I always recommend the new Jim Crow, so people can talk about how, again, systems of incarceration are just the new form of slavery and segregation. The Color of Law talks about redlining in cities. So again, as an example, here in the city of Denver, they've already done a heat map of communities where COVID is hitting the most.
Wow.
Those communities, Black and Latino communities. Right. So again, what does that mean in terms of redlining and districting of areas? What does that mean in terms of gentrification and the rising housing costs in our communities? What does it mean those areas that were highlighted have poor air quality? So it's an environmental justice issue. So, getting ourselves educated on things like that, even reproductive justice. I've seen a lot of folks talk about that. We know that the rates of domestic violence and child abuse have gone up since COVID and these stay-at-home orders have started. Shelters and hotlines are being overwhelmed at this time. Because we know isolation is a key factor in intimate partner violence. And if we're requiring people to isolate, it's only exacerbating the problems. So again, I think this is a time to get ourselves educated on a lot of these issues that are affecting us, our loved ones, our friends, our neighbors, so we can, once this is all lifted, so we can go to action and create change.
Absolutely, absolutely. And I love this idea of getting locally engaged, right? Because so much of our focus can be nationally. When we think of elections, we think nationally, while a lot of what affects your daily life is what's happening locally. And so getting involved in whether it's like a local town hall or a local activist group or whatever needs are facing your particular area in your particular space, it could be great to have your involvement there. So I really love that recommendation. If, as we wrap up today, if you were to say in 5 words or less, something to people listening about how they can go about weathering the storm of this pandemic, what would you say to them?
That we're all in this together, that we're all responsible for each other's well-being during this time. Social distancing or physical distancing isn't only to protect myself, but it's to protect my community. So with all kind of social problems, it's a community issue. So communities need to get together and think about how do we support each other during this time? That if I go out and I'm at the park playing, again, I'm affecting my neighbor's health and well-being. If I have people who are still required to work in at-risk kind of populations, they're responsible for some of the spread of this. So figuring out how, as a community, we can come together and resolve this together and make sure that we resolve it quickly. And again, think about those next steps in responding once this is all resolved.
Absolutely. We are. And I love the idea that we're not all in it together just now. We're always all in it together. And even when this is all over, again, what impacts you is still going to impact me. Therefore, it's imperative that I care about the things that are impacting you and impacting my neighbor. Dr. Alexander, tell us if people wanted to stay in contact with you, learn more about your research, or just team up in any way with what you're doing, how could they go about doing that?
Yes, you can find me on aprylalexander.com or follow me on Twitter at Dr. Apryl A. And again, get involved, ask me questions, and I'd love to respond and continue this dialogue.
Awesome. Thank you so much for being with us today. I hope all of you got some really good gems. Get involved locally and care about the people around you. I think that's sort of some of the biggest themes that we've shared today. But please feel free to stay engaged with us, drop a line or a comment in the section, send Dr. Alexander or myself an email or anything if we can be of help to you. But stay tuned for more of these amazing interviews with other great experts. Thank you again, Dr. Alexander. See you next time, everyone. Bye.